estimated 440,000 Americans die each year because of medical errors. Some analysts consider it the third leading cause of death after heart disease and cancer. Diane Atwood, who writes the blog Catching Health, is here with some important safety and prevention information for us.
And a couple of sad stories. Today is the 9th anniversary of Bob Pollard's death. He was 34 years old. He went to his local emergency department because he had a tearing sensation in his chest, followed by off-the-chart pain in his abdomen and chest. It radiated to his neck, jaw, and shoulder. It wouldn't go away. He also had this feeling of impending doom. He insisted that something serious had happened to him in his core, but the clinician in the ER diagnosed him with constipation and sent him home. Bob died 4 hours later of an aortic dissection. His aorta split right down the middle, and it could have been repaired with surgery. 83-year-old John McCleary got MRSA pneumonia while he was in the hospital with a broken leg. MRSA is a strain of strep that doesn't respond to normal antibiotics. Now, most infections happen in a hospital setting or a long-term care facility setting. His broken leg healed, but John never fully recovered from the MRSA infection, and he died in a nursing home a few months later. These stories drive home the point that we need to be strong advocates for ourselves and for our loved ones. The reality is, our healthcare system is not perfect, and neither are the people who work in it. So I have 5 tips to share today. The first 4 come from Kathy Day. It was her dad who died of MRSA pneumonia. 1, ask for clean hands all around, doctors, nurses, other caregivers, and your visitors if you're in the hospital. Keep hand sanitizer at your bedside. Whenever possible, bring an advocate to medical appointments, spouse, child, friend, whoever you trust. We need extra eyes and ears, especially when we're in a stressful situation. And speak up, whether it's because you don't understand something or you think your hospital room needs cleaning. You need to say something. 4, check your doctor's or your hospital's rating on one of several ranking sites. I've got links to sites on my Catching Health blog. And the last tip comes from Bob's sister, Kathy Pollard. If you don't agree with a clinician's diagnosis, you need to ask for a second opinion. It can prevent serious complications, or it can make the difference between life and death. Now, you'll find more tips and information about preventing medical errors and infections on the Catching Health blog.
I think this is one of those times where you need to be the squeaky wheel. It's life or death. It really is.
You do, and so many of us are afraid to speak up, but we need to speak up and sort of take charge of ourselves and our loved ones.
Makes a lot of sense. All right, thanks, Diane, very much.
You're welcome.
We'll take a quick break and we'll be right back with our final half hour of the morning. Don't go away.